Good morning, everyone. Good morning. Today I am going to present on the topic how raised serum cortisol and VEGF levels correlate with severity of diabetic retinopathy. Now, as we all know, hemodynamic changes in diabetic retinopathy occur as a result of altered ocular blood flow, which occurs due to hyperglycemia, rheological changes, tissue hypoxia, endothelial dysfunction, and pericyte loss. In patients with type 2 diabetes mellitus, hyperglycemia and insulin resistance leads to oxidative stress, which causes inflammation and apoptosis of retinal ganglion cells and inner retinal capillary endothelium, which leads to changes of diabetic retinopathy. Hyperglycemia and insulin resistance is governed by hormones like cortisol and growth hormones, and apoptosis mediated through growth factors like VEGF. In our study, we took age group of 40 to 65 years, in which there were 46 cases of diabetes mellitus and 15 healthy controls. Should I restart? In our study, we took age group of 40 to 65 years, in which there were 46 cases of diabetes mellitus and 15 healthy controls. The cases of diabetes mellitus were divided into 3 groups: no diabetic retinopathy, non-proliferative diabetic retinopathy, and proliferative diabetic retinopathy, as shown here. Informed consent was taken from all the cases, and study was done in Department of Ophthalmology, KGMU Lucknow, in duration of 1 year. Under ocular examination, we did best corrected visual acuity through logMAR, slit lamp and fundus examination was done, and SD OCT was performed. Under blood sample analysis, we checked human VEGF assay through ELISA and serum cortisol levels through chemiluminescence microparticle assay method. Blood sugar levels, HbA1c, and hemoglobin levels were also measured. This table here shows demographic, biochemical parameters, cortisol and VEGF levels of 4 groups, which clearly states that serum cortisol and VEGF levels were significantly increased in non-proliferative and proliferative diabetic retinopathy groups. Mechanism of action of cortisol are linked to hyperglycemia and insulin resistance in diabetic patients. Oxidative stress, growth factor, and hormonal imbalances linked with pathogenesis of diabetic retinopathy leads to activation of mitogen activated protein kinase that plays a role in form of signaling component for VEGF and as a regulator of endothelial cell permeability. Our study demonstrated that serum levels of VEGF and cortisol increased significantly as the level of retinopathy increased from diabetes with no retinopathy to proliferative retinopathy. This study has highlighted for the first time that serum cortisol and VEGF levels are significantly increased even before the signs of diabetic retinopathy develop in patients with diabetes mellitus. With this, I would like to conclude my topic that raised serum cortisol and VEGF levels correlate significantly with severity of diabetic retinopathy. Thank you.
Can you just go back a few slides to that chart where you show a comparative? Just stop there. And you were saying that there is a higher HIC correlating with the severity.
Yes, ma'am.
Right?
As the severity increases, the cortisol levels were increased.
Correct. But as a predictor, you are saying in diabetic retinopathy.
Yes,
so where will you put off your cutoff as what is your normal cortisol
Ma'am,
level? Because
we did ROC curve for cortisol, in which the cutoff was 9.5.
9.5. And for the VEGF?
Ma'am, VEGF, the cutoff was 300 plus minus 10.
Correct. So which means that if you look at the levels at the bottom, the VEGF is not showing such a big difference in the non-diabetic retinopathy, but the cortisol level is a better predictor, correct?
Yes, ma'am.
That's what you're saying, that VEGF rather, cortisol is better predictor than VEGF.
Ma'am, both are good predictors, but maybe if we do with large sample size, the difference will come more.
Correct.
So, thank you, Dr. Akshay.
Thank you, ma'am. Thank you, sir.
And this is a one-time snapshot that you've taken, right? Have you tried to see them serially to see how it behaves in terms of if their diabetic control is improved or their systemic situation changes, whether the...
No, ma'am. It is a one-time.
It's a one-time thing.